Hello everybody and welcome to my YouTube channel. This is Dr. Mridula V. Amarnath here. So gently, when the mother is approaching towards her term or delivery date, and when the newborn baby is about to come, the house is usually full. Either you have your parents or your in-laws, a lot of elderly folks coming over to welcome the baby and take care of the baby. So the initial 1 to 2 months, post delivery, you have a lot of people to take care of your baby, give baths to your baby, help your baby to sleep, everything. So you are completely at ease, and over a period of time you pick up and you carry on from there. But since the past 2 years, because of COVID and various other circumstances, a lot of these elderly folks were not able to do this. They were not able to go and take care of those little babies. So I remember a lot of first-time to-be parents had contacted me, had consulted me, Doctor, can you please tell us, how do we handle a newborn baby? Or how do we hold a newborn baby? What are the different positions or the ways that we can hold our baby? So I thought, yes, probably they did not have anybody to help them, and that is why they're asking me. So I feel it is important that I share it with you also, because it is important that we should be responsible and we should have an idea about how we take care of our baby right from day one. So I'm going to share with you the different ways about how you need to hold your baby, and the different important things that you need to be extremely careful, because babies are really delicate. The bones are still not formed, their neck is still so soft. So we need to be extremely delicate and gentle with them the initial few days. So I'm going to give you a step-by-step guide as to how to handle your baby during the initial few days. So the first and the most important thing is wash your hands. Always before holding your baby, make sure you thoroughly clean your hands with soap and water, because your baby's immunity is still developing and they are prone to a lot of infections and diseases. So it is important that as much as possible, I'm sure it's not possible to wash your hand each time you hold your baby, but as much as possible, either have a sanitizer or wash your hands with just soap and water, wipe it thoroughly, and then hold your baby. The next thing is, make sure that you are comfortable when you're holding the baby. Because I've seen a lot of parents, they struggle, they hold like this, bend like this, no. So make sure first you are comfortable, because when you hold the baby, you should feel confident. Yes, the baby is, safe. Baby will definitely not fall, or I'm doing the right thing. So you should be comfortable so that you have the confidence within you. The next most important thing is to provide support. Now, when you're holding a newborn, it is very important to always have a hand to support the head and the neck. The baby's head, like you all know, is the heaviest part of their body at birth. And also make sure that you give special attention to the baby's fontanelles, which are the soft spots on top of their head. Now, newborns also lack the critical neck muscle control to keep their heads supported on their own. So now this milestone isn't usually reached until they're close to 4 months of age. So next, trying to figure out the right position, which is both comfortable for you as well as for the baby. So maybe the baby is comfortable in a lot of positions, either when you're holding him like this or in a cradle position. So but the most important thing that you have to keep in mind is, when you're holding the baby, make sure that the baby's head and neck are always supported, the baby is comfortable, and simultaneously even you are also comfortable. So I'm going to share with you the different positions. The first and the most common one is the cradle hold. Now this is the easiest and the best way to hold your newborn for the first several weeks of life. So now how do you do it? Now, with your baby horizontal at your chest level, slide your hand from their bottom up to support their neck. Now gently nudge the baby's head into the crook of your elbow. Now while still cradling their head, move your hand from the supporting arm to their bottom, and your free arm will be able to do other things or provide extra support. The next one is the shoulder hold. Now in this position, with the baby's body is parallel to yours, lift their head to your shoulder height. Rest their body on your chest and shoulders so that they can look out behind you. Make sure you keep one hand on their head and neck and your other hand supporting the baby's bottom. You know what? In this position, you can actually listen to the baby's heartbeat or feel the baby's heartbeat. The next position is the belly hold. Now in this position, lay your baby's stomach down across your forearm with the head up towards your elbow. Now their feet should land on either side of your hand, angled closer to the ground so that the baby is at a slight angle. Now how is this position useful? Now this position is extremely useful if the baby is gassy and needs to be burped. Gently stroke on the baby's back to work out the gas. The next one is the lap hold. This is a very comfortable position, Sit in a chair with your feet firmly on the ground and place your baby in your lap. Now their head should be at your knees and face up. Lift their head up with both your hands for support and your forearms under their body. Now the baby's feet should be tucked in at your waist. So these are the different positions that you can try out. You can keep changing because I'm sure in one particular position the baby cannot be comfortable for a very long time, and neither will you be comfortable for a very long time. So try out a position in which both the baby and you are also comfortable. Next, I'm going to share with you some things, do's and do nots, which you will have to follow in whichever position you're holding the baby. First, always try skin to skin contact while holding the baby. Now this is a great way to bond with them and keep them warm. Try to choose a seated position if you feel nervous about holding the baby during the initial few days. Now sitting down is also a good idea for anyone who might not have the strength to support the baby's weight. Use an infant support pillow when you're holding the baby for extended periods of time or to get help, especially while breastfeeding the baby. Make sure you do not cook or carry hot drinks while holding the baby. Knives, flames and excess heat are extremely dangerous and could lead to injury by accident. Stay away from others who are working with those things near you. Hold your baby with both your hands while you're going up and down the stairs for added safety. Make sure you never ever shake your baby, either whether it's to play or to express your frustration, because doing so can cause bleeding in the brain and even death. So that reminds me of another tip which my mom used to always share with me. So she used to constantly tell me, do not sit at the edge of the bed, especially, while you're putting the baby to sleep, because there are chances that when you're putting the baby to sleep, even you feel a little drowsy and tired and exhausted, and you might just fall off if you're sitting at the corner of the bed. So she would constantly tell me, always sit in the center of the bed, middle of the bed where you have support on either sides, and make sure that, you put the baby to sleep, put the baby on the bed or cradle and then go to bed. So like I said, there is no particular rule book that this is the only way that you should hold your baby throughout. No, there is nothing like that. You should feel comfortable, baby should feel comfortable, but most importantly, make sure that their head, again I'm emphasizing on that, because make sure that their head and neck is always supported, and enjoy. Probably the initial few days you might feel it a little difficult, a little scared, but trust me, by the end of 1 week or by the end of 1 month, you would master it. Okay? So take care and have a great day.